Hi, my name is Hannah Smolich. This is the Started in Stanford podcast, where I interview the entrepreneurs of Stanford to figure out more about what they do. Today we have Nick Johnson with us. Nick, would you like to explain a little bit about what you do in the healthcare industry?
Absolutely. So I'm Nick Johnson, and I'm the director of engineering at a company called Intake, where we're building a urinalysis machine that sticks onto any toilet, sucks your pee out of the water, and checks it for some really specific biomarkers related to your health. And so now I'm here in Stanford developing the technology, managing other engineers, entrepreneurs, and scaling up.
Wow. So, how do you think this product is going to change the future of home healthcare, or what exactly are you hoping to do for it?
Yeah, it's a good question. So in the short term, especially with all this COVID coronavirus craziness,
Mm-hmm.
we're helping people monitor patients at home. That's our initial goal. And one thing that we've been seeing trending is because of COVID, the people who normally go to the doctor all the time because they have heart problems or kidney problems, liver problems, they aren't going right now because they don't want to get sick. And that's catastrophic. I mean, that can only end in a bad way. And so one thing that we provide is a way to track their diet and baseline them remotely so doctors can keep tabs on them without them actually coming in. So that's the first thing. And the second is we're really honing down on hypertensives, people with high blood pressure, because we can really accurately measure your sodium every single time you pee. You go and pee like normal, you press a button. That's the only thing that's different from going to the bathroom normally. You don't have to hook this thing up to Wi-Fi or anything like that. And it starts tracking your data. So over time, I think what we're really going to change is the way that people track what they eat, because you can get a snapshot of what's inside of your body every single day.
Awesome. Quick follow-up question about COVID-19 with this. Um, do you already have this product out where doctors are able to track these people's healthcare from their homes so far? Or are you just hoping that this is going to be a product that is going to eventually be able to do that in the case that this could happen again?
So that's the full intent. Right now, we are getting our first few units out to do a pilot, and we're
Okay.
piloting it with some self-insured companies so that they can test it out in their kind of ecosystem first before we roll it out to everybody. But hopefully, and the goal is within the next 2 months, we'll have a couple hundred units out in the field that doctors can use to track their patients without having to bring them in. Yeah.
Yeah, because that would be very, very helpful for a time like this,
Yeah, absolutely.
for sure. Um, Next question. So, why do you think Sanford is a great location for being able to change the way people are tracking their health?
So Stamford and Connecticut in general is kind of a unique place where we have a lot of area and not a lot of people. And so even though we have hospitals all over the place, are really accessible, um, it's a lot more distance to travel to get to hospitals. There's a lot more hospital visits. The billing is still high. So I think because of that, it's so manageable, and it's not stacked like New York City where you have all of these different patients that you have to track. It's kind of in between. It's very suburban. So we have a kind of a perfect test bed here where we can
Yeah.
roll these things out, keep tabs on people in a manageable way, and scale up slowly. And we can just move. I mean, we're 30 miles outside of New York City. We can just kind of keep moving it closer and closer if we want to scale that way. So I think it's perfect in that regard. And then we do have great hospitals here. Stanford Hospital, Tully is kind of a center in the area. Then we have the hospitals in Greenwich, which are great also. Then over in Westchester, I mean, we're positioned perfectly for these hospitals that doctors from New York City are coming to. So they have great staff, and they're up to date, and they're willing to use technology. So it's just the perfect kind of mix of things.
That's
Yeah,
great. Yeah. I know Stanford definitely has a lot of great professionals in the area. It's definitely an entrepreneurial hub as well. So that's great.
exactly. Yeah.
Um, However, what can be difficult about working in Stanford?
Yeah. So I think as far as healthcare goes, especially, there's not a huge tech network here, and it is hard to get people to pick up new technologies. I mean, if they're going to do it anywhere, it's probably going to be somewhere like here.
Mhm.
But one thing that we're looking at, especially with our technology, is that we're really targeting big blue collar companies as kind of a first way to roll out, just so that we can make money. And that doesn't really, there's not a lot of that here in Connecticut. So I think we're leaning towards more of the forward thinking, tech thinking companies. But really, our ideal client is someone like Home Depot, who has a lot of older employees, or maybe a manufacturer like Purdue, who's making chicken. They have a lot of older employees who have high blood pressure, and they'll roll these out to all of their employees, and we'll start selling units like crazy. Um, but I think in the near term, going the medical route, Stamford is pretty good for that, and Connecticut in general. So I see that as a challenge, but also as a benefit. Yeah,
That's great. I mean, I would hope too that with you in healthcare, it would also be um, not necessarily easy, but you have the ability to get great grants for being able to do this. And, hopefully people will see a need for it because it's definitely would be helpful in a time like this and even all the time.
exactly. Yeah, we actually are currently federally grant funded by the National Institute of Health and the National Science Foundation. So that's what's keeping us floating. Yeah, they totally see value in this, and we're hoping to get it out because it really could help a lot of people really quickly.
Yeah,
Yeah.
definitely. Most definitely. Do you have any other thoughts specifically towards, the healthcare industry and how it might be helpful for how the industry is right now with the issue of COVID-19?
Yeah, honestly, this at-home testing, whether it's our device or not, that's the future of this stuff, because
Yeah.
so many people got sick because they went to the doctor, and that's never going to change. Now people know that that's possible. Sure, it'll take another pandemic after this one's over for that to happen, and people will get used to normal life. But now
Hmm.
we know that people can work from home. Why not go to the doctor at home too? So telehealth is going to be a big next step, and I think that that's a good place. If someone were to be watching this and think, "What should I do next?" I think telehealth is a great avenue, um, and great opportunity space, but also can be really helpful. So
Awesome.
yeah,
So basically, this product is really going to help people, specifically, probably the elderly community, but really everyone in general who wants to track their health and to be able to use this technology to just help their doctors even track their health as well and really be able the next step in home health care.
exactly. Yeah, that's what we're
Perfect.
hoping for.
All right. Well, thank you so much for being involved in this podcast. We hope to reach out to you again. Thank you again.
Thanks, Anna.